Try to keep my cat out of here.
No, get your cat in. Ladies and gentlemen, Dr. Larry Burchett, again joined by Dr. Jane Janab. We're both ER doctors on the front line. We went to medical school at the University of Kansas. Go Jayhawks. And we wanted to give you an update today as of Tuesday, March. What is today?
It's
Dr.
St.
Janab.
Patrick's Day, 17th.
And the message on St. Patrick's Day is the best way to celebrate St. Patrick's Day is to stay home.
Yep.
Is to stay home. I think it's funny how things are changing so fast, and it's like, okay, I know what to do today. The message is stay home, don't go out.
Yeah.
But then still seeing so many people that went out last night, went out this weekend, and it's like, yo.
We're on beaches in Florida.
Yo.
Yeah.
We got to dial back.
Yeah.
We got to dial back. Dr. Janab, you're heading to the front lines in a couple days. You're in Denver now.
Yeah, I'm flying back to North Dakota on Thursday. That's if flights are not grounded, which is, it's going to be a real problem for a lot of these small hospitals. I think we may have talked about it last time, but hospitals like the one that I work in rely on people from out of state and even out of country sometimes to fly in and be the only ER doctor in the hospital for your shift with, 2 or 3 nurses on at a time. And those hospitals, when if and when flights are grounded, they're not going to have staff. And you're simply going to have a hospital with no ER doctor, and that is worrisome.
I was just thinking about that. It seems like things are progressing in that we're just going to be more and more quarantining and being able to go out and do less and less. I don't know what you are anticipating. I think things are going to get way worse in terms of numbers of cases and deaths in the United States. And then there will be a reaction to that to clamp down even more. So I didn't even think about when you told me I'm going to fly to North Dakota where they need me, but I might not be able to fly because of the flight. That's crazy.
Well, I happen to be one of the people who is within driving distance somewhat. It's a 12-hour drive, but I will be making that drive if I'm the only doctor who will be able to staff the hospital. So I've already been contacted by them. I had told them last week because I had anticipated about 10 days ago that at some point they would consider grounding domestic flights. And the news came out today that they are in talks about that with the airline industry. But I had told them that if it came to that they could still count on me. I still would be going out. But
because you can drive there.
I can drive. 12 hours is a long drive.
They would never shut the roads down, were they? That's even.
I can't anticipate that would happen. I can't anticipate that would happen. But one, the airlines are seeing such a dramatic drop off in passengers and people wanting to travel, and 2, enclosing people in an airplane for an extended period of time, some of whom might be ill and could potentially pass on the virus, is probably not a good idea either.
Yeah.
So
talking about what to anticipate, and then people, healthcare workers are going to get sick, doctors and nurses,
they are sick.
Involved, and
they are sick. The last number I saw was we're up to 3 ER physicians now intubated and in the ICU. And that's just the ER doctors. We're also seeing, there was a PA that I heard of. There were cardiologists, nursing staff. We're also, unfortunately, and somewhat understandably, we're seeing people calling off from work who simply don't want to come in because they know that they're going to be exposed. We're seeing people quarantine. I have friends who are not allowed to go back into work right now because they're waiting for their test to come back. Because when the healthcare workers get it and then they're seeing patients, some of whom are very ill, some of whom are at very high risk that if they contract this, they're going to die. What do? You have to remove that dilemma. You got to remove that person from patient contact so that they're not potentially causing harm simply by being there. But when you do that, then that increases the burden on the people who are there. We have some larger hospitals who are trying to move to having young, healthy physicians seeing the people with respiratory complaints, having the older physicians step back and do more, non-infectious disease type things, such as taking care of traumas
Sure.
and OB and things like that. Problem with that is, again, we are seeing that repeated. It seems like repeated exposures puts you at a higher risk for developing more serious symptoms and disease. So we are seeing young and healthy. One of these ER doctors that has been in critical condition is only 44 years old.
Yeah.
That's not that high risk category of patient, but he has been repeatedly exposed, we think. So what we're really needing right now on the front lines, and what we are in desperate need of, and what I'm getting more and more kind of frantic messages from people who are seeing higher volumes in their states, is that we're lacking the things that we need to protect ourselves. What we know from talking to the healthcare providers in China is that what has been protecting them is kind of full body suit, face shields, and not just a simple mask, not just an N95 mask, because we need either a complete face shield that has its own separate breathing system that we can use. It's called a PAPR, a PAPR, and head to toe gowning. Or we need the ability to have the N95 masks, which are the ones that filter down to a very small virus size and will keep the virus out, in addition to goggles, in addition to gowns and gloves. And we have a shortage of that right now. People don't realize it's almost like we talked about earlier, like it feels like we're girding up for battle, we're going into war, and we're the troops this time. You don't send troops into battle without ammunition and without protective equipment. And you're sending all of us healthcare workers into this pandemic, and we do not have the ability to protect ourselves. And as we become ill and are taken out of that workforce, there are going to be less and less people to care for more and more patients, because we're anticipating that surge, because there are a lot of people out there who are infected but not terribly sick right now. But we anticipate that surge, where all of those people who took 7 to 10 days from initial infection are all going to get sick at once and are going to be coming into the ERs, that we're not going to have ventilators, we're not going to have the ICU beds, and we're not going to have the staff. And the staff that are there are not going to be safe while they're at work.
So what's one thing people can do to help with the shortage?
There is a link going around right now that allows you to fill in your information and to essentially sign something that...
What's the name of that link? Where can they find that?
They can find it on my page. I've made it public. I don't remember. It has to do with the personal protective equipment, the PPE.
So if they feel like donating some stuff to the
front
line.
No, this is more about contacting your representatives and urging them to work, that the government works to ramp up production of things like masks and gowns.
So contact your representative, and part of the message, what you want to say is invest in this stuff and put more stuff on the front line.
You've got to protect the healthcare workers, because who's going to take care of everybody else? The other issue that is problematic is a lot of us are independent contractors. And if we get sick, we don't have paid sick leave. We don't have, some of us, the insurance that's going to take care of us when we're ill.
God, this is a problem, like not only for doctors, but I think about everybody from, well, I mean, not just in the healthcare industry, but
in the society.
Yeah, waitresses,
we're lacking the
and
social
trainers, and just on and on, teachers, and on and on and on.
We're lacking that social network. And I hate to say that this crisis is shining a light on where we're falling short when it comes to caring for people overall, let alone from a healthcare standpoint.
So I want to talk a little bit about, you and I started off saying, don't go out. I was reading some stuff, and I want to get your thoughts on this too, that it seems to be more and more clear that young, healthy people in general are going to be okay, but can get the illness and not show any symptoms at all, and then can transmit the illness. And at the same time, and here's the important thing, those folks staying home and not transmitting is is a worthwhile thing that will make a difference to, flattening the curve, that goal that ultimately will save lives. Have you heard that too? I feel like that's becoming more clear.
Yeah, not only young, healthy adults, but also children. We think that some children may be almost completely asymptomatic, meaning that
Carriers, yeah, it's like they're a carrier
they're
for the disease and they don't show
they're
any symptoms.
they're not going to have the fevers, they're not going to have the cough, and they're going to be, running around doing their kid business, and unfortunately are um, going to be infecting people. So that's why it was so important that they did close the schools down in most places. That's why it's so important that they are urging people to stay at home, because we need to somehow slow the spread. We're not going to be able to contain it completely. This virus is here. We're all at some point in the future likely going to be exposed and likely get it. The question is, can we mitigate the severity of um, the volumes of the people that we're going to see who are going to need life-saving measures all at once?
Yep.
That's the whole flattening the curve. Because if we can spread those numbers out to a manageable number for our healthcare system, less people are going to die. If they all come at once and they all need to be in critical care beds and on ventilators at once, the numbers are not in our favor. We simply do not have the resources to care for all of those people at once.
Yeah, that's when we would get into trouble. I want to, I worked yesterday and the day before in the ER, and I want to tell you what I experienced and kind of bounce this off you, but it's a little scary going in there these days. It wasn't crazy. Our volume, I think, was a little slower than normal, but when I got there, I was told, and this wasn't just for me, but it was for the other providers that were in the ER. We had 5 tests on Sunday that we could use. 5. And so we had to turn away people that were coming in with mild disease, a little cough, a little
Mhm.
fever. Their oxygen level was okay. They didn't have pneumonia or severe complications from this. At that time, they didn't get a test
Yeah.
um, because the rule I put in my head was, I'm going to save this for somebody who's sicker, who's either admitted to the hospital because their oxygen level is low or they've developed
Mhm.
pneumonia, or who's critically ill and
Yeah.
intubated.
Yeah.
And so you spoke a little bit about dilemmas. So this is one example of basically rationing because we didn't have enough tests. Now the
Mhm.
second day, I was told we had 170 tests.
Better.
Okay. So and my guess is, and this is the point that I wanted to make to people, is my guess is that there are some similarities to this across the country where testing is going to be more widely available. So you can
Yes.
see that on Sunday, at least for me in the Central Valley of California, really had to ration testing. But then as it opened up a little bit, there will be more testing and people will be able to get it. And so what does that mean? The test takes a couple days to get a result, at least where I was.
There are new tests that are being developed that will give you a rapid response, and we're
Meaning
talking
like,
15 minutes to 3.5 hours is what we're hearing, but those are not widely available yet, and that's another message that we need to get out there. The government needs to get us the
I
tests. We
really
need
feel
to be
like
able to.
we should have
We,
had tests.
we should have had them a long time ago. There's just no way around it. But we need to have them so that we know, you know, if we're sending someone back home who potentially has it, who has an elderly parent at home, or who is a caregiver for somebody who is receiving cancer treatments right now, they need to know that they can't be anywhere near that individual.
It's a really sticky dilemma for the average person who is healthy and
Hmm.
gets some symptoms for precisely what you're just saying. On the one hand, do you want to like just stay home, not come to the ER and not kind of add to burden the system or whatever, which I think is reasonable. But then on the other hand, for a lot of people living their lives, like it would be helpful to like I don't want to give it to anybody. Do I have it? You know?
Right.
Let me give you
So,
let me give you a story. I want to tell you this. I want to tell this story. So I had a patient on the second day when I had more testing, and she was a middle-aged nurse who had some heart disease. and she had shortness of breath and a cough. We did a whole workup. Everything looked fine. But she wanted to know, did she have, was this coronavirus? I didn't think so, she didn't have a fever. She had had this longer than, she had had it for a couple weeks. She wasn't critically ill. I didn't think this was corona. But she wanted to know two things. One, was she, exactly like you said, like she didn't want to go back to work. She worked in a hospital on the floor. She didn't want to go back to work and be like, am I giving this to people? She wanted
Right.
to know for that reason.
Mm-hmm.
And so we did the test, and she's going to have to stay at home for 2 or 3 days and be quarantined until she gets that result, and then
Mm-hmm.
knows, okay, now I need a full 14 days, or no, I don't have it. It's okay to go back. But then the other part of that issue that she and I just sat and talked with her about, and like I'm her doctor in this moment, trying to figure out
Mm-hmm.
what is the right thing for her. So let's say she's 50 and has some heart disease. She had a little bit of heart disease, and so for her to go back to that it's not the front line, but it's still into the battle, putting herself at risk, like what's the right answer? She's not like, if it's a 70-year-old nurse who's hanging on by a thread, probably needs to stay out. But then we're also going to be in this shortage time, and so
Yeah.
it's there's this dilemma of it. But I will say this: so many people have been inspiring. She was more concerned about giving it to other people and didn't want to be doing that
Yeah.
than she was the risk to herself. And so I was sitting there talking with her about it, and I was like, I'm a little bit worried about you. I don't know what the right thing to do is.
Mm-hmm.
We're going to need you, but on the other hand, there's a risk to your life that only you can make sense of. It's not 50% for her, but it's not
Yeah.
0.2%. So that's like part of the dilemma that we're getting into with this thing.
I agree. And one of the issues that is going to have to change, and is going to have to change quickly, is that right now every state is doing it differently. So in some states, you still need the health department to give you approval to run the test. And in some hospitals like yours, you have the ability to make that decision. We do have a lot of people who are going to put other folks at risk if they don't know whether or not they're positive for the virus, but we're not able to test all of them. So they need to, one, produce more tests and make them available to everyone, which is the promise that was made by the government, but they have not been able to follow through on that yet. And two, raise the restrictions for who can be tested. Here in Colorado, we've had drive-through testing, but we had 150 maybe tests per day, and you had thousands of people in their cars lined up trying to be tested, and they had to turn away the majority of the people who were trying to get tested.
These places are still getting overwhelmed big time.
Yeah.
So at least for us, right now the test is taking 2 to 3 days. Excuse me, 2 to 3 days to get a result. What I want people to anticipate, and I want you to tell me what today's numbers are in the
Sure.
U.S. cases and deaths, whatever they are today.
Mm-hmm.
Not only so our test results are going to go up because we're testing more.
That's
And
what people, I think, are really not understanding,
so
is that
so we're going to see a huge crazy
huge.
spike in cases,
Yes.
and then there's a death toll that will also continue to rise. I don't know how many we're going to be talking, hundreds, thousands, tens of thousands. Some people have said hundreds of thousands. But I want
Uh,
people to anticipate that in a couple days, at the end of this week, this thing's going to go like this. Media's going to go
correct.
crazy again.
Correct.
They're going to go
And
crazy.
what people should think of when they look at those numbers is that, one, we talked about this earlier, there are probably 10 to 20 times the number of people who are out there who are infected with this as compared to who have tested positive for this, simply because we're not testing enough people. If we
We're
had enough tests,
unaware of the
of
reality of
who's
how much
of
this
who's
disease is
positive.
circulating. Yeah.
Exactly. And it has been circulating for, a good 5 or 6 weeks now, silently in the community. Um, and once we start testing, you're right, those numbers are going to go through the roof.
They're going to go.
But that's only because we're actually testing people, not because there has been this immediate spread that we were unaware of. The spread has already happened, but you can't count numbers if you're not testing people. So once we
It's like, how do we know about it if we're not testing?
That's why we need tests.
Sick people will come in, like we'll see
Hmm.
them coming into the ER. They'll end up in the ICU getting sicker on vents, and ultimately
Well,
the death toll will rise. And that's another way that you would know. But
yeah.
there's a lag. There's
Uh,
a 10 to 2 week lag on that.
which is why, I mean, the fact that we were not on top of this from the beginning and we're not testing like other countries have been testing from the beginning is shameful. But the numbers for today you were talking about, so right now we have 6,340 positive patients. We're up to 106 deaths in the U.S., and that's a bump of 20 overnight. Looking at Italy today, they had 345 deaths, and we're lagging a week or two behind Italy and Spain, and they're seeing just really significant numbers. And if people want to have an idea about what we might see here in the U.S. if we don't get on top of this, go look at some of the reports from physicians in Italy and Spain, and they're giving you their firsthand accounts of what they're seeing. Um, yeah.
Okay, so let's transition a little bit from doom and gloom and anxiety and stress inducing, which I will admit I feel the stress and it's taking a toll on me. Let's
Yeah.
look at some things that are good. Number one, children are not dying of this thing, thank God,
Very
because
good.
that would be
Hmm.
so much worse. Number two, this was a great piece of news. Wuhan, China opened some things back up for business. I heard they even closed some hospitals.
They closed their last emergent hospital that they had opened to care for coronavirus patients. So
And they closed it
because they're not getting more cases, they're just trickling in instead of having the volumes that they had. And they accomplished this, folks, by doing what our government is now asking that we do, which is social distancing and quarantining when you are positive. It can be done. It can be done. We can do it here, but we have to understand that we all have to do our part in that, and we need to be responsible, and we need to think about the more vulnerable people in our society who will die if we do not do what has been asked of us, which is to stay home.
we've got great examples, luckily, in front of us with China. This worked. Let's do that. Play your part in this war effort. Italy's struggling. We don't want to be like them, for sure.
Yeah.
Um, what other positive things do we have to look at these days? I want to try to um, let's talk about mental health for just a second.
Sure.
I did have a patient that had a panic attack from reading the news too
Sure.
much.
Yeah.
And so I would say, for people, definitely take care of yourself, check into this. Don't constantly be take breaks. Like,
Yeah.
we may be in this thing for weeks to months. We may be
Yeah.
quarantining for a couple months.
Well,
How are you
there
going to take care of yourself, Dr. Janab? What do you tell people about that?
are there are a few positives about where we are in history right now. One, the fact is we can talk to each other, see each other via what you and I are doing right now.
Totally.
And I would recommend reaching out to your loved ones, reaching out especially to your older friends and family who maybe are really kind of shut in right now and isolated. Reach out to the people that you know who struggle with anxiety, who struggle with depression, because social isolation essentially is what we're up against right now. We have ways to help with that. Um, I've they say to look for the helpers, and I have taken such joy in seeing the creative ideas that people are coming up with to go shopping for their elderly neighbors so that they don't have to go to the grocery store and
Or the
expose themselves.
elderly shopping hour for
The
three
elderly
hours
shopping
where
hour
only
for
they can go there
correct,
so that they're not competing with everybody else and so they're not getting exposed to younger
correct.
people.
Yep.
I love stuff
Um,
like that.
there are companies and celebrities like Peloton has. You ask how I deal with the stress I have. I'm fortunate enough to have a Peloton bike and the app. Even when I travel, I can do meditations, I can do yoga, I can do weight workouts, I can do biking workouts. They have made their app free for 90 days to
Oh,
help
wow.
with with social distancing. So that's a way for people if they're in their homes because the gyms have been closed. If they're in their homes and they're looking for a way, I do the meditations at night. I fall asleep listening to their sleep meditations. It calms my brain
Mm-hmm.
after having been dealing with coronavirus for 14, 18 hours a
Mm-hmm.
day. Um, there are people famous chefs who are doing free online cooking courses. There are musicians who are doing free online concerts from their home.
Although I would say, especially for these guys that normally make their money in these ways,
Mm-hmm.
it's okay to try to do something online with your trainer and pay them. I
Oh,
think
sure.
about all of these folks that
Yes.
depend on this income and
Yep.
creatively figuring out a
Rest.
way of how can we, like
Rest.
you're not going to go out tonight. Why don't, if you were gonna drink, get a 6-pack and then donate the rest of it to your bartender or your waitress. I know we don't know these people, but just how can we all stay together in
The
this time when people are gonna, be needing
ordering
paychecks?
ordering in from restaurants. There are so many restaurants who are going to end up closing their doors potentially permanently due to loss of revenue. I've been trying to, I know this is not something that everybody can afford to do, but for those who can, still trying to patronize the local small businesses. And one way to do that is to order in. A
How
lot of
can you
places
do
have
that
offered.
while staying home? Exactly.
Exactly. A lot of them have offered curbside pickup as well, so that you can drive, but you don't really have to see anybody, and they have the bag ready for you, and you grab and go. Um, so there are a lot of ways to help out. If you have the ability to donate, a lot of food banks, more than actual food, they need cash so that they can go out and buy healthy food for the people who are really going to be struggling due to lack of income, who were already struggling and needing help. There are going to be a lot more people who are going to need that help, and more than actual canned items, they could use money so that they can purchase or make meals for the folks who are going to be food poor right now.
So I think kind of in summary, take care of yourself, including your mental health, do your part, which includes the social distancing, and then getting into some of the stuff that we're talking about how can you contribute and be thoughtful of those around you, the elderly, the sick, those folks that aren't working. This has
This
been a
is a
great
great,
chat, Dr. Janab.
yeah, this is a great opportunity for people. 10 years from now, how do you want to look back and remember how you handled things during this time? Are you the person who went and you bought 1,800 bottles of hand sanitizer so that you could mark them up and sell them to people for $70 a bottle? Or are you the person who went and bought groceries for your elderly neighbor and potentially saved their life? So you got a choice here. I hope folks make the kind one.
Celebrate St. Patrick's Day by staying in. Take care of yourself. Dr. Janab, when you return to the front lines, you take care of yourself too, okay?
You as well. Good to talk to you.
Thanks for doing this. Let's do it again soon.
Sounds like a plan. Bye.